So welcome back, healthy people, to On Call with Dr. Randy. Today I have my fellow colleague, Dr. Shin. How are you doing, Dr. Shin?
Ooh, I'm doing good.
Thank you for joining me.
We should have one more day off.
Yeah, you and me both. I feel like we need to work on how to get that 4-day work week.
Oh, yeah. Let's go for it.
Yeah.
4 days.
Yes, we gotta go for it. So I wanted to bring Dr. Shin on to talk about acupuncture. She is one of the physicians at my clinic who does acupuncture. So I thought it'd be a great topic to talk about another way besides medication that we can treat things such as inflammatory bowel disease, headaches, pain. We'll get into all the different treatment options that you can get from acupuncture. So what made you learn or want to get into doing acupuncture?
I grew up in Korea, so traditional medicine and Western medicine I'm sort of exposed to both. I personally got exposed when I sprained my ankles frequently, and I was in medical school. Got treatment for myself, and it's kind of amazing how quickly I could walk again and the swelling reduced. But I didn't think about much of things because I was focused on like learning science and other things. And in political environment in Korea with acupuncture is like it's sort of separation, like we don't cross each other. So there's Eastern traditional medicine kind of route you learn, and I was in the other route, so Western medicine. So basically science, physiology, biology, what you're more familiar with. So after the graduation, although I had a personal experience that was like, interesting, but, got busy with the life and everything. The personally I got really interested in and then started maybe thinking about it was about the time I graduated and then when I got pregnant. So around 2010, when I graduated from residency program, that's when all the opioid crisis, like whole social issues became more, an issue because the thing we learn is like opioids, but then we can't use it anymore because of that, the whole issues. So I had to okay, what are the options I have? My patients are still suffering, whether they're addicted or not, whether it's a right treatment or not, but I didn't really have an options. And I got pregnant and then I got into more, okay, maybe there's something more I need to learn because there aren't that many options for pregnant women to deal with a lot of different symptoms. We had to just pray, basically, let the pregnancy end and just by the time. So I somehow I got a brochure with a holistic medicine. Like, maybe there's some answer here. And I went to the conference in Arizona, and then they had a big whole thing of a holistic medicine thing. This is around 2011, 12. And then they would assign me a mentor and how to study this and how to practice in our current clinical setting with the insurance and everything. So he recommended me to learn acupuncture. And then he said there's like 2 programs. One's a Harvard Medical School. The other one was West Coast, a E11 course. But the West Coast is kind of too far from me. So I chose the East one. And that's where I got my acupuncture degree. So so like mostly personal reason, but then, I had to practice medicine, in a sense where I didn't quite learn about much how to handle these chronic pain issues. I don't think at the time, none of us were like handling very well. And, we got confused a lot by the big pharmas who was selling a lot of opioids. And then, but then, by the time we got out, like, oh, that's not my option anymore, especially as a primary care. So That's how I got started.
Okay. So you mentioned that you received a lot of acupuncture treatment during your pregnancy. What kind of treatments did you get with the acupuncture?
I learned acupuncture. I didn't I was seeking some answers, right? I was
Oh, okay.
kind of tired. My back was hurting. So I didn't get to try it. I wish I did, but I sort of after first trimester and then things got better too. But I was like, my coping skill is to learn and to research and what other options are. So I learned and like, okay, so, when your brain is into something, you kind of forget other stuff. So the learning was my coping skill at the time.
Okay. So what is acupuncture?
So acupuncture is using a needle to treat many of our, symptoms that our body expresses. It could be a pain, it could be a nervousness, it could be your stomach symptoms. As we're all learning, our bowel has more nerves now than the brain in some research. Depends on how you count, I guess. So I think it's a great way to reduce any of our symptoms that we're suffering from. Somehow I think it's like 3,000 years of practice of a human body, how to touch and how to release the symptoms. So it's based on, I guess, observation science. It's not like a big randomized control statistical science, but it is how they learn. So I think it's just using needles is kind of interesting because you've got these pointy things that will prick our skin that activates some of the receptors in our brain to respond a certain way. But usually that prick causes more of a body's relaxations.
So it originated in two different areas. Did it originate in Japan and China? And do they treat it differently, the techniques?
It originated initially in China. So 3,000 years ago, they had to have some way to treat royal family symptom. So that's how when the initial acupuncture came out, and then they, the royal family had headaches or stomach problems with the herbs and the needles that they were able to treat their symptoms. But it's gotten like the more and more population they start applying to, and then moved to Korea, and then from Korea to Japan. I think to Japan it went around 1,400 years ago, from Korea to Japan. So I mean, each country has like basically very similar maths, slightly different techniques where they focus on. I think Koreans are really big about hand acupuncture. Japan's is more palpation based, and how the United States have come across this acupuncture was introduces. First, it came to like West Coast because there are a lot more Chinese there. And then that's where the ham style is more prevalent. And then I think the master from Japan came to like Harvard, I think when the research people, and then they went to Japan. They brought the people here to sort of set up the academical research, and people actually can practice. So from Harvard Medical School, where I learned it's more of a kind of stems from Japan. Very, very similar in many aspects, but there are some points that are slightly different, and the skills are slightly different too. What they're focused on, what they're trying to treat in a traditional concept.
So how are they kind of slightly different?
So the points where they name and locations are maybe about 1% difference. And then the Chinese medicine, they incorporate a lot of tongue diagnosis, other qi diagnosis, pulse diagnosis, and then they also uses the sensation of qi as the main goal of a treatment, where usually the patients feel that something is moving inside of their body. So maybe sometimes like when we relax, we can kind of feel like tingles and things like that. Like our nervous system is changing its input to our brain. So they call it chi. And then they feel they are successful if the patient have felt that. Whereas Japanese techniques are more palpation based. So they have a very important concept called hara, Hara, in the stomach. And then they palpate on the base, the stomach. In the stomach, they believe the problem originates from. So that's why all the meridians have internal organ names, like livers and kidneys and pericardium, heart. So it's on your hands and the whole lines of it, but it has internal organ name. So they focus on more in the internal organs name and organs to releasing that portion of it to release something that is blocked in your system. So again, it's trying to make the chi, which is an energy, flow in your body, but also it very focuses on GI system or abdominal area of organs per se. So you press one area that is hurting, then you can release those points by other distal points. Then once you have reduced those symptoms, then the other points that you were actually hurting, that gets better. Well, how I'm understanding, because I learned the medicine, Western medicine, our brains and anatomies and physiologies first, is I think it's a very similar to gate neuron theory, where if a certain areas of your brain thinks that, okay, this, chronic pain, there's usually one spot, let's say neck, right? Neck pain. Then the whole your nerves is more focused on that. And everything that is controlled in your spinal cord for the gate is increasing the inputs of it. But it's not necessary, right? For the bots. And sometimes it's inflammation, chronic inflammation, but sometimes it's just the nerve perceiving those pains or exacerbating the pains. So if you're reducing the sensation by, in translation, they use the word dispersing. So dispersing that energy to other places and it more evens it out and balances out, then you have a reducing symptoms of that pain or, relieve the pain or resolve the pain.
It seems like the nervous system plays a major part in a lot of the ailments that people come to see us about, probably more than we recognize overall.
Oh, yeah. Brain is what expresses what perceives the symptoms, right? But a lot of chronic symptoms, I feel like, okay, the accidents and injuries, whatever happened, and it has a result. But somehow nervous system lingers there to let us know it's been there. It's evolutionarily, it's important, right? It's not to do those things. Let's say you tend to sprain your ankles, then you'll be more careful about walking. So you would think about something not to do that. So it will teach us those process will teach us how not to do it, how to prevent those things. But not necessarily our symptoms goes away even if we learn those things. So maybe that's imperfection in our body, or maybe that's how our body designed to eventually go away. But so I think that's how our nervous system works. And then, but we suffer because after those kind of events and injuries, if the pain lingers, when this person suffers, right? So we need to reduce those symptoms to have a better quality of life.
Right. That pain ties into making people feel more depressed, and then that can affect their GI system. And then it's just a kind of vicious cycle that they go through. Yeah. So what are some of the typical things that people come to see you for to help them out as far as with acupuncture?
The most common symptoms are back pain, neck pain. Those are the, as you can see as a primary care physician, most common pain symptoms, of course. Headaches are also common. Treated somebody with anxieties, ringing in the ear, the tinnitus can reduce some of that. So any kind of various symptoms that bothers, they seem to help. The most
So
common
let's
pain.
just kind Okay. So let's just kind of set the situation where I come in to see you. Like, oh, Dr. Shin, I've been having back pain for like 3 months. It's in my lower back. Oh, it hurts so much. It doesn't radiate, doesn't go down my legs. I've tried everything as far as stretching and taking ibuprofen, but nothing has worked. Right. So what's the usual process for you to treat somebody with back pain with acupuncture when they come in?
So the cool thing about acupuncture, you don't have to take a whole bunch of history. I mean, once I realized, okay, proper workup is done, no red flags. Already their physicians has done the due diligence for that. And then we're not dealing with any cancers or something that has urgently needs to be dealt with. Then we just can focus on body, what body tells us. So I start palpating patients. Patient lie down supine, so on their back. And usually I put the pillow on their legs so the backs are more comfortable. Most of the back pain, some back pain is really uncomfortable when they're lying down. So we got to position it right so when, well, they feel comfortable. And, but most often, 2 pillows on the legs, so that helps. Some people need like 4 or 5 pillows, but that's rare. Then I start palpating around their neck because a lot of times people with the pain kind of hold their attention around the neck as well. They just don't realize that's because body only recognizes it as a more important pain, so what they perceive the pain. But it's there are other parts of the body that is also has a muscle spasms and more pain issues. So I start palpating around the neck, SCMs and trapezius, so all around the neck area. And I feel, okay, so there's right side, there's many tensions on the SCMs or trap. And then also start there palpating their front, because even though it's a back pain, sometimes it can come from pelvic pain. It can be coming from hip pain. So usually I palpate like a lower abdomen area, like ASIS. It's like a little top of your hip, where it's a bony area, and or a groin area where you would palpate mostly the inguinal pulse, inguinal area. So it's kind of in the suprapubic area. So I would palpate that and see if there's any, pain or tenderness. Because you can compare the right or left, so you can see even if the patient did not know that there was a issue with perceiving those areas of pain. When I palpate, and then they notice, I didn't know that I had a pain there. So I would do that, and then based on that hara, H-A-R-A, hara, in the stomach area, there's some protocols we go through. And then if there's a certain area of a tenderness, then we try to release that. And then body start relaxing. So you can kind of tell you neither one and palpate the person's tender or painful spots. And then it's a little reduced. So you check in, make sure, okay, it's actually working. So it's continuously communicating, because patients, including myself, if I'm meeting the person first time, never actually felt their body, like where they're sending the signals. And then, like I said, if the brain has one signal that is very intense, the other signal has been ignored. So we tend to find that sometimes there were hidden issues. So we release those areas of attention. In textbook, it's called stagnation. And then after we release the stagnation, then the patient, that's usually takes about 15, 20 minutes. And then we'd flip the patient, kind of like a massage table, your face would go down. There's like a thing that holds your face. And then the person will lie on their stomach. There's some people who cannot do that, and I'll have them lie on their side. And, of course, they will make them comfortable with the lying down for about 20, 30 minutes. And and then we'll now focus on where they feel the pain. So often they would have a tenderness, meaning like if I touch it, they would say that's a pain. But now our goal is to disperse the pain or reduce the signal. So we're using other points that are known in the textbooks that could reduce those side of a pain. So we'll needle it and check it. We'll needle 1 point and check it. After many experiences and seen the patient a few times, where to go, where the needle goes, and they'll relieve the pain. So
it's a lot of give and take feedback between you and the patient, kind of trying to figure out where the pain is like actually at.
Yes. So first, a couple of meetings, very important to having understanding, communicating where the pain is, how the pain responds with the different points. Because there are many points which could reduce those painful spots of the nerve that is activated. But everybody's body is different, very similar, but also different. So we gotta have to kind of practice. But after a few times, we'll learn it, and it becomes a little quicker. So after that, and then it sort of feels like the size of the pain reduces as this process goes. And later, then there's like a few tiny points that they would say it's tender. And I would just needle that area, and then the pain goes away.
Wow.
So it's pretty cool.
Yeah, that's pretty cool. So about on average, let's just say in the same situation with the back pain, how many needles do you use for that? And do those needles actually pierce the skin?
So you can, the skin layers, right? Cutaneous, subcutaneous, those layers. It rarely goes subcutaneous. It's just the cutaneous. It's just kind of like a pinch. It's a round tip of needle. So it just gently stimulates the receptors of the skin. Sometimes I get lucky and I hit the tiny blood vessel and it will have a little pinprick of blood comes out, but that's even rare. So the needle never goes very deep in this style of acupuncture. But there are some different style of acupuncture that would go deeper. And there are some points that would go deeper. But usually it has a lot of fat layers that would, protect it from a person getting bleeding or infection. So the risk is very, very minimal. Anyways, the needle goes very shallow. And what was the other question?
About how many needles do you use for back pain?
Oh, how many needles? I would say average about 40. Could be 50, but depends on the person. But then, as I get to know them, I could use less needles. But some people stay in a high number of needles.
Mm-hmm. Is there a big difference between the needles used for this and dry needling?
So dry needling is a little thicker and little more rigid. So it's a stronger. And then it is mainly designed to unkink the muscle that is kind of wrapped like this. So the needle goes in to unwrap it. So it has to have a proper, deeper layer of a stimulation into the muscle layer. So those needles tends to be a little bit bigger, a little bit stronger.
Okay. And so you said patients also come to see you for migraines for acupuncture. What's the difference in the technique that you use to help people with migraines?
So migraine is basically the same thing. I would check their neck, I would check their head, and trying to find the points that were hurting. I'll check their stomach, because a lot of times that way, sometimes the migraine has like a lot of stomach symptoms, nausea. They'll have some tension in their stomach. There are some points in their stomach that would have tensions or pain. So we'll release that. And a lot of migraine that where we can access is like where the muscle is, right? Temporalis, SCMs, and then the muscles in the neck as well. So those muscles, if I palpate, there will be tenderness. But those whole has a lines of acupuncture points that, again, that has some, some of the protocols that release that, you use these points or something like that.
So how long does it usually take for people to see the benefit? Like, do they come to you and see you again in 2 weeks and then follow up every month, or it usually takes more sessions than that?
Typically they have a relief, like as if you're getting massage. After massage, you feel some relief, right? Like you feel better and then kind of relax. So typically it depends on person. A person will have like 80, 90% of a symptom that reduce. Some people may have all resolved, but after a few days, due to their habit or whatnot, then it comes back, and then we try to learn how to prevent those things. What caused this? How many steps that when they walk to the parking lot, that it start causing that? Well, can we do some more core strengthening? So something to prevent and something to lengthen those treatment periods. Yes, so initially I would say every 2 weeks, because that's typically if something happens, those inflammation happens, and then how the body copes, how the body behaves, that will tell us a picture of what is main cause of this. I mean, mostly aging, but something other than that, or is there any other way we can cope with this?
So you kind of mentioned earlier talking about opioid drugs. Have you been able to get some of these patients that come to see you off of stronger medications and just using acupuncture as their primary treatment?
Yeah, there are many patients who are at least cut down quite a bit of their opioid use, or at least they are, they were able to reduce enough that they could be functioning from the day to day. Because if they're in the very high dose, how the opioid can make people really not functioning throughout the day. They can make it sleepy, groggy. But yeah, some people came at least very minimal. Maybe used to be used daily. Now maybe every once in a while.
So you kind of talked about
thankfully,
earlier.
the people who would come to see me is already has an intention to get better from opioids. I know, a lot of us as physicians, we struggle. People just want to stay on opioids because we know it's bad, but it's, we can't really truly motivate them at times. And, I know that's a struggle, but I'm lucky that where patients comes and see me are usually very motivated to come off of them.
Right. And how long you been doing this as far as just acupuncture? About 10, 12 years?
Yes, about that. Around my daughter was born 2012, so.
Okay. So how have you seen it change since your initial learning from the beginning? Like how has the science changed with acupuncture?
Oh, well, when we graduated from med school and training, we want to do everything, right? So I thought I could treat everything because that's what the textbook said. But I realized that there are some things like back pain and neck pains are pretty good in terms of treating those symptoms. I think there are a lot of mental health, like anxiety. It's a very good therapy for helping to reduce their symptoms. But because the anxiety and depression and it's more deeper, the brain kind of chemistry issues, often noted that it's probably best to keep them up with their medications or therapies in addition to acupuncture. So yeah, initially, I was very eager to treat everything as if my as a primary care, okay, I can treat it this and this. But I think it's a little more difficult to treat some of the mental health issues, but it's I think it's more like pain, anything pain related issues. It's a little more effective. I mean, it's a lot more effective. I noticed that with experience for the past 10 years. So, I can be honest in saying, yeah, the neck pain, I can help you with the pain. You probably need to be on medications. You have anxiety and depression. But I can help you with, in addition to that, to either reduce the dose of it or help with your symptoms of coping.
Have you had any pregnant women come to see you to help you out with their pain during pregnancy or nausea?
Oh yeah, absolutely. Like the back pain, I've been through also, and nausea. Those are one of the two main things that pregnant woman goes through, and it's been very helpful because there are very limited medication options for them. And a lot of times, it's adjusting the brain to adjust a certain signals to send. It's not really sometimes a pain. It's more pressure, or it's more of not sharp pain. So there are certain things we can also help the pregnant ladies to cope with their symptoms.
I'm assuming it's pretty safe for the baby overall, but what's the typical process when women come to see you for pregnancy issues?
Probably the position, and I probably need a little bigger bed and then better cushion. And again, it's a position is the most tricky part because they have to feel very comfortable lying down for up to an hour, although we change position in the middle of it. So getting the right position, right amount of pillow, right amount of a blanket, that's the most challenging part.
Mm-hmm. So if someone is going to see an acupuncture specialist, how do they know when they're doing it wrong? Like, what are the things that they should look out for when they're going to see someone and having acupuncture for the first time?
I think most acupuncturists are pretty honest, and they are there to help you. And if your symptoms not getting better, obviously nobody's go there and pay the money for it. But if there's any increasing, very severe pain, a lot of a worsening of pain, then in the last, then there may be something going wrong. It's very rare, and it's only I've read it in case report or just somebody's told me about this case. But if somebody's a very malnourished and don't have much of a subcutaneous fat or very thin, the acupuncturist has to be very careful about needling. So similar to like chiropractor would have to be very careful about old ladies with osteoporosis for manipulations, right? So with the one who are experienced would know that not to needle either too deep or not too many around the area of the neck or up a lung area. But I guess things happen, and I hear cases about pneumothorax, which is puncture of the lungs, where they get air in the lungs and that's like an emergency. You have to
air in the wrong space. We want you to have air in your lungs, but not in that space.
Right. So that's pneumothorax. Yeah, that's one of the worst cases scenario. But again, that can be prevented from the acupuncturist being very careful. I would say be aware of it. Someone keep trying to sell you like herbs and supplements. I don't know. I would say if you want to go see somebody who knows herbs and how to properly use the supplements in the right, I think you would have to use like somebody herbalist, and some would do both, but it's really hard to do both. So it's like you and I are family physicians. We're not surgeons, right? So it's like doing two could be very difficult, although that's possible.
Right. So you mentioned earlier talking about how this can improve a person's chi. inside. So what kind of feedback have you gotten from your patients, how you've helped to improve their chi?
So they say they feel more energetic. They feel like, I mean, I don't say those things before because I didn't want to preempt, like as if I don't want to suggest their brain to think it that way. But they've been telling me like those things and describing in a way, oh, something moved inside, or oh, I felt something tickles. And then usually those patients that express those symptoms, that has a great results. So yeah, those are my lucky days, right? And they feel like they are more energetic. They slept much better. They just like look happier. They're like different people, like I'm seeing from first visit, second, third visit, and then they know it's working.
That's good. That's real good to hear. Is there a time period when you can max out on going to acupuncture, like you've reached as much as you can help them out?
Well, so theoretically for acute, although I cannot apply it in my current practice, I've heard some acupuncturists like doing this as a full time. They can see any acute symptoms 2 times a week. Like if you sprained your ankles, my personal experience, I went there 2 times a week for about 2 weeks. So if it's acute symptoms, we would do with our patients, if it's acute and then more severe symptoms, we'd see them more sooner, right? So it's the same thing for acupuncture. You can see like almost daily or every other day for the symptoms. A lot of patients I treated, they have chronic problems. So I see every week or every other week. Most common is every 2 weeks. I have a patient who comes in every week.
Yeah, I recognize them. I say, didn't I just see that person last week? And they're back for their acupuncture.
Yeah.
So if you had to leave any lasting words of wisdom for anyone considering doing acupuncture, what would you want to tell them?
So it's not scary at all. I mean, it's been used for 3,000 years safely mostly safely with a few minor exceptions. If you have a lot of chronic pains, that you don't really have true organic problems, or you have organic problems, but your symptoms are that your body is experiencing, or your brain is telling you that it's greater than it should be, or you want to reduce the symptom, just try out the local acupuncturist. I have some website that I've learned to go and to find out who's the acupuncturist would do this kind of styles. If my patients are going out of states or moving somewhere else and they ask me, and then I can give the names. There are different types of acupuncturists. So if you try one style and didn't work, and you can try a different style as well. Kind of like different types of yoga you can try, and then one may work and one may not. And so it's kind of a person, and if you meet a person that you can trust and you can ask them if something's not working, then, is there anything else you can help me or recommend me to see somebody or try something else? So sometimes it's a trial and error because this is not, cookie cutter kind of a medicine. It's more of a relationship, and it's more of like experience and repetition and relationship building, that if you feel, and then if you find somebody that you can trust, you can let them, advise you. And again, it's not a scary thing to try at all. Like, don't think that, oh, needle, I have a needle phobia, I can't do that. But we also have a like non-needle techniques too, like those points and pressure points and things like that, we can try. I sometimes tell my patients to use some of the massage bowls to use there in the pressure points if that were, they were doing great within the treatment session. Oh, this point really works for you. And you got to stimulate these points, things like that. So again, the needle could be scary, but these are not the same needles that you would think about in typical doctor's office. There's a large thing and a very pointy hurts. This is more like round tip. If you're looking under microscope, it's a round tip. So it's basically just pushing the skin. So just don't be afraid. There's always a help. Your doctor may say, I can help you, but if you're sick, there's going to be help. So.
All right. And so that website, is that something that patients can go on their own to find out where's the local acupuncturist in their area?
Oh, yeah. So I go to, my teacher was David Euler, and then I go to his website, davideuler.com, and then he has listed all those acupuncturists in each state that would practice this style of acupuncture. And if I'm looking for specifically like this style of acupuncture, that's where I go look for.
Okay, so we'll make sure to put that website in the show description so you can go and look it up on your own, all my healthy listeners that are listening to this episode. So thank you, Dr. Shin, for being on this episode of On Call with Dr. Randy. And as you know, I always end with Randy's random questions. Are you ready, Dr. Shin?
Okay.
All right. So question number 1. So you're about 2 to 3 weeks out from having LASIK surgery. What is it like walking around not having to worry about glasses anymore?
Oh my God. I'm so happy. And I'm thinking, why didn't I do this earlier? This is like a new world. I mean, there's still a little bit of glare that somewhat bothersome a little bit when driving at night, or a little subtitles on the screen on the TV. But other than that, oh my God. And to be honest, I didn't know that my glasses, when I'm looking at the otoscope, that was giving me some sort of like different image. Now my brain reads a lot clearer when I'm doing the ear exams. Like there's no, I would say, there's one film is gone. So I think that when I was wearing glasses that I didn't realize, that was giving me a different kind of signal. But I can see the ears a lot more clear now. So it's amazing. Like everywhere is so clear.
Aha moment.
I was like, I didn't notice. I mean, before, how did I not see this one before? I'm so happy. I mean, I wish I could have done it sooner.
What made you do it now?
Oh, yeah. So I start having vision issues, the prescription would change. And then so I got a new glass, but they wouldn't work. It was giving me headache. It was so, blurry, and it's so weird. And then I went back to my optometrist, and he said, "Oh, you need a reading glass now." So it's like, no way. So it was a shock. And then they got me transition, the progressive, and it would still give me headaches. And I think it turns out only when I'm a little tired, I would need a reading glass. It's not like that. But then because of its transition, the progressive, the different, so my brain will keep having issues with the images and where to put my visions. Anyways, it was giving me a lot of headaches. And plus, I saw my husband did LASIK 5-6 years ago, and he's still alive. So, okay. So I think that would work for me too. So I got his LASIK surgeon's name, and then I got to book it. I can use a reading glass as it progresses, but I cannot do both. I cannot do with my glass that I used to wear, and then, but the amazing thing is I don't even need a reading glass now. Like now, somehow everything is so clear. And
Welcome to
even
my
at the end
world.
of the day, I just need to close my eyes and just put ice on it, and then it becomes normal again.
Okay.
And then it's good. Like I don't need anything. I hope this lasts.
Yeah, I've heard about that. I've heard about it not lasting as long as it should sometime. So, question number 2. You, Lucy, and your husband have taken many trips together. Where's the most favorite place that y'all have gone together?
Our favorite place. Oh, we really like Seattle. Lots of good seafood. We like recently Maine. I didn't think that I would like that much, but it was so beautiful, like the sceneries and how cool that was. It's just sort of escape from a whole heat wave recently we had. So it was really nice.
Which one did Lucy like? I know that's the one that you like, but which one out of all the trips that she's been on does she feel like she liked the most?
Oh, she said that she likes all of them. But whatever, I guess, the recent memory of hers, I mean, most recent one being we went to Tybee Island and we saw dolphins and going up and down in the ocean. So she really loved it.
Okay, that sounds good. So I'm gonna go look up Tybee Island because I don't know where that's in. She's already traveled to a place I've never heard of. So, but I appreciate you
So
being on
Tybee
the
Island is
podcast.
really, yeah,
Tybee Island is
it's
what?
not that far. It's like only 4 hours. Yeah, Tybee Island. It's in Georgia.
Oh, okay. So that's down the street. I'm thinking y'all went over there to like in Asia or somewhere, or just like in Europe
No,
somewhere that
no,
I
it's a
didn't know of.
Tybee
This right
Island
down the.
in Georgia. Yeah.
Okay, so this in my backyard. I don't have to look it up. I just gotta look out my window.
Yeah. That's a Savannah, Tybee Island, that area.
Okay. Well, thanks for being on, Dr. Shin, and sharing some great information on acupuncture. Looking forward to have you again on in the future.
Yeah, thanks for having me.
All right. So I'm gonna press stop on the recording. Let's see.